morning.
Good
And
morning.
how are you today?
I'm great. How are you?
I'm fine. I'm fine. I'm excited today because
Mm-hmm.
I'm encouraging my nurses who have been watching and who have been so engaged
Mm-hmm.
on the Empowering New Nurses show to show up this morning. Some of them have been making some positive comments, of which I know there are many who are gaining a lot of knowledge and
Mm-hmm.
experience. And I know today that you are one of our young nurses who have been commenting and really giving some applause. And I really appreciate that. And that has been motivating other nurses to come on. And I'm excited you're here today. Can you just tell me something about yourself? Now, this is the Empower New Nurses show.
Yes.
I'm excited
Mm-hmm.
because it's bridging some gaps that have able to help other nurses who might be contemplating and who might be thinking that they want to leave nursing. But we don't want that to happen because we have outstanding nurses like you, a young nurse who have been empowering other nurses and inspiring them too. So tell us a little about yourself.
Well, I'm Katie, and I'm a registered nurse, and I'm still a baby nurse compared to a lot of our veterans, despite what Dr. Smith says, because we have amazing nurses like Dr. Smith who have been a nurse and practicing in the nursing field since before I was born. So I'm still a little baby nurse, but to encourage you and empower you, nursing is so diverse now. It's come a really long way. Before, there was only the traditional setting for nursing, meaning you would work alongside a physician in a hospital. And there's just so much more to nursing now. There's like skilled nursing facilities, there's assisted living facilities, long-term care management, telephonic nursing. So it's just really broad now, more opportunities, more flexibility.
Wow.
I think that's also very important for a lot of nurses that wear many hats. Some nurses, have spouses, they're moms, and a traditional nursing schedule, 12 hours grueling away at the hospital, not even getting a chance to use the bathroom. That's not really what they want.
Right.
And they're not going.
The younger nurses, tell the world right now about what nursing is like now to what you knew nursing used to be, even from hearing of some of the nurses, their experiences, the older nurses, the seasoned nurses, their experiences that they had, in comparison to that, what would you say as a young nurse? Some of the changes that you have observed.
Yeah, change is inevitable, whether it's in nursing or in any other career. But in nursing, it's just so rapid. I think the pandemic accelerated that a little bit, even though we're used to change in nursing. But prior to even me being a nurse, my mom was in nursing and my siblings are in nursing. And so I have a long history of nursing in the family. And they talk about some really horrific stories. And you hear about a lot of trauma, a lot of untimely deaths that could have been prevented had there been more equipment, technology, staffing. And my mom, would recall working in Jamaica and my sister wanting to go be a nurse in Jamaica. My best friends are nurses in Jamaica and other countries all around the world. And so nursing differs. We've had nurses that I've worked with that migrate from the EU. Yeah, they migrate from all over the world.
For example, myself, I was recruited here in 1986
oh my goodness.
as a critical lead. I'm not sure even you were born yet. What I'm saying. So we have come a long way.
A long way.
I mean, when you think of it, what we used to do as opposed to how it, you would say technology and science has brought us to a different era whereby nursing is a profession. You don't have to be like, say, walking behind the doctor to do this. I mean, people from my time, they realized that the decision makers and the decision making at that time were mostly the doctors.
Yes.
Yes. The nurse would be like helping, as it were.
Yes.
But
it's so different now.
Your voice.
Yeah.
You have a voice. You have an advocate for both yourself and for your patients.
The new nurses now, their voices will be heard, and they are not afraid to let you know. They take no abuse from some of the older
And no
nurses.
bullying either.
No bullying. They will walk off that job, honey. Okay. And it's starting to be a little bit of an issue because we have to change the culture in nursing. And I think it is changing, one shift at a time. The beautiful thing about management is the work remains the same, but how the work is done and the unity of our team, it's sometimes a direct result of the management that we have. So I think nursing is changing, and for a really positive way, because we've seen where a lot of the hospitals and health systems were crashing because we were not seen as a valuable commodity, and nurses were in unsafe work conditions and unhappy working environments, unhealthy schedules.
Okay.
And they started doing
okay. So one of the things that we have seen is that the younger nurses, the millennials, many of them, they are not going to be, should I use the word loyal? Or not use that word. But they are sometimes, they are not going to take certain things.
I think I would like to pass the baton of that to the Gen Z nurses, because the nurses that were born from 2000 and up to now, they don't take any of the abuse that us, the millennials, have been absorbing, and they voice their opinions very quickly. They unify and actually encourage us and empower us to unify against the abuse as well. And it may seem a little disloyal. However, there is more honesty now in nursing. Before, I think it's also a part of some cultures where we don't talk much about money. And these new nurses, they're like, how much are you making? And then when you tell them, they're like, oh no, you're making half of what I make. And so that, you reconsider, am I really doing the right thing here? Are you willing to do the same thing and get paid more for that? So it may seem a little disloyal, but when you're not being provided with additional education, staffing, safety, you go somewhere else and you don't have to deal with management. You won't have to deal with the bickering that happens with seniority in certain hospitals. And you won't have to deal with not getting paid what you want.
All right. So listen, let me just piggyback on that. As a millennial, and as opposed to a baby boomer like myself, you would see that the millennials now, many of them, they would say, travel nursing, if money is there, I'm gone. Right? Now, healthcare institutions, they're upgrading, as it were. They're ensuring that you'll get paid for you. They encourage you to, advance your education, and they encourage you to specialize, as it were. So in doing that, that will help retention. Have you observed in any way at all? You have worn many caps. You're in different capacities. You have played many roles. So can you tell me whether in a long-term setting or in a hospital setting, but in a clinical setting, what has that been like for you?
Okay, that's a really good question. I have been in an institution where they did offer an incentive for education and for assisting in the financial aspect of my education. I am completing my master's degree. I'm actually almost done. This is like my final 2 weeks of the program.
Congratulations.
Thank you.
Yeah.
And so I have a particular company that I work with as a nurse, and they offered to pay for a portion of my degree.
Great.
The hoops and regulations and red tape that I have to jump through to get any type of assistance with this company was not worth it, because I still ended up just paying for it myself because of the hassle that I felt I had to go through to get the assistance. Granted, I'm employed there. I'm still going to be employed there, but I literally walked away from that because they've made it too difficult to assist financially in the payment for my degree. You're either going to help and let it be a seamless process, or you're not going to help. And I already have to work as a nurse, and the job is stressful. And I already have to work as a student. Being a student is also very stressful. I'm doing these things simultaneously. That is double stress. I don't need additional stress of you doing what you said that you would do. So that's not really a great incentive to a lot of people, because that also seems to be across the board in nursing. They offer to help pay or tuition reimbursement, however they phrase it. But the reality is sometimes it's just too difficult. And I am a very simple person. I don't want to deal with the drama. There may be others who will take the opportunity and say, I'm not going to let this free money pass me by. However, some institutions require you to work with them for a certain number of years if they put in a financial contribution to your education. You sign that in writing. And sometimes, especially now, people don't want to be bonded, contract in that way, especially when the working conditions are not favorable to them.
Thanks for saying that.
Yeah.
But right now, you mentioned the word stress more than once. Now, what are some of the self-care that you would encourage our young nurses right here now to participate in? Give me about 2 or 3 of them that you think that will be helpful to our nurses who are listening right now. What are they?
I think we're all different. I know even you and I, we're women, but we're so different in what we like.
Yes.
So you have to kind of know yourself, right? You have to learn yourself as a woman, as a man, and see what you like to do. Some of us think, going to a spa, getting my hair done is going to be self-care. And really, maybe you want to go in a vineyard and just have a relaxing moment. You want to go horseback riding. You may want to take a painting class. You may want to go do a pottery class or throw some clay. It doesn't mean what everyone is saying, self-care. You may not like taking a bath. You may not like someone touching you for a massage. But whatever it is that makes your heart happy, make time and make room
for that.
For yourself.
Put that a part of your schedule. It's important.
Your priority. How do you go out here and take care of somebody and you're not taking care of yourself? So you need to take
care of yourself.
Exactly.
So that you'll be able to produce. You'll be able to care for others, and they'll be able to enjoy.
Use your PTO. We were talking about this earlier. And you better use your PTO because in the moment that you're incapacitated, you're not able to perform your duties, you will be replaced, because healthcare is a system. Healthcare is a community service-based system. Healthcare is a job. And the moment that you're unable to perform your job satisfactorily for whatever reason it may be, you will be replaced. And so if you don't take moments to replenish and revitalize yourself, you're going to be replaced voluntarily or involuntarily.
Wow, that's strong. Okay. Listen, I'm so grateful to you for having come on this morning to share these wonderful, what should I say? What's the word? Tips to our young nurses, and of course our seasoned nurses, because we can learn from each other.
Yes.
Now, as we have come to the end of this little discourse, I'm not going to say a little discourse, because I put out so much this morning to impact our nurses, to remind them that it's important to take care of themselves.
Yes.
It's important to do their work to the best of their ability.
Yes.
Because we do have patients who are dependent totally.
They're
vulnerable, and they need you. And it's our responsibility to provide the highest quality care that each patient deserves.
Yes.
Each patient deserves.
Yes.
Regardless of their color,
race,
regardless of their race, regardless of their diversity, regardless of whatever educational status, whether
Sex.
they are poor or rich, whatever orientation they are, it's important to provide the care for humanity.
Quality care.
High quality care. And that's what we emphasize and re-emphasize in the Empowering New Nurses show. Thank you so much for coming on. Now, how can I be contacted? I can be contacted on...
You can be contacted on... I can be contacted on Instagram, Facebook, TikTok. It's all Healing Prayer Ministry.
Great.
Healing Prayer Ministry. Oh my goodness. For the first time, I think of my ministry not just in the spiritual sense, but also the physical.
Because great. Because guess what? We believe.
Yeah.
We believe we were created with a purpose.
Yes.
And each patient deserves the best.
Yes, they
do. When we think of health, we not only think of the physical or the emotional or the social.
Yes.
We're thinking of the vital part of the spiritual.
Yes.
And that's part of your strength.
Yes.
In your ministry.
Yes. That is
we really appreciate you coming on to share that.
Thank you.
Now, to connect with me, you can go on YouTube at Miriam Amanda Smith, on Instagram at Podcast Mayor, and of course on Apple, Spotify, Miriam Smith.
Yes.
It was a pleasure having you here today.
Thank you, Dr. Smith.
And I look forward to seeing you again.
Yes.
And you can just tell some of your friends also about it.
Yes.
Thank you.
You're welcome. Be encouraged as a nurse. Don't be discouraged. Don't think about the hardships. Don't think about the codes. Don't think about the short staff. Think about your purpose. And be encouraged that you're doing the very best that you can.
And every day, you're helping someone to get better.
Yes.
To be able to provide, to be able to contribute to society.
Yes.
Thank you.
Thank you.
Thank you.